Hello, everybody. My name is Doug E. Fresh, and I am here today to talk about some serious issues that have been affecting the African American community. This is a very special panel. I'm honored to do it, and it is definitely something that I think is important for us to talk about because there's a lot of things that have been going on in the communities around the country and especially in these trying times, with COVID-19 and just all of the different things that have been affecting our lives. And one of the things that have been affecting our lives in a major way outside of COVID-19 is just us not having enough information from a health perspective to make better decisions. I've been involved with Hip Hop Public Health for a very long time. It's a foundation that me and Dr. Elijah Williams formed, and we try our best to get information out. So this right now is one of those times where we're looking to get as much information out as possible. I want to thank Bristol Myers Squibb for helping us make this happen. And this platform that we have some incredible people on it, and I want to start to introduce them so that we can get right into it and start this up. First on the platform is Kimberly Alexander, and she is here to provide the patient experience of relatively rare blood cancer, which is undiagnosed in African American communities. And she will share her experiences because she is definitely a true advocate of just getting the word out and just making sure that people can get this information once again to change lives. We also have Dr. Joseph Michaels, who's a thought leader as well as here. He's a specialist in multiple myeloma, which is affecting the African American community. And we want to know so much more about it because it's a very, very deep topic that a lot of us just really don't have enough information about. And last but not least, we have the Robert P., the pastor, the living person with multiple myeloma who's been handling it, living with it, experiencing it, and you can't get better information from a man who is dealing with it. So I want to thank all of y'all for being here. I appreciate y'all taking out the time for us to come together and talk about these topics that we normally don't have a conversation about. So first, I would like to start with you, Robert, and I would like to say, can you tell us your story?
Sure, I can. Thank you first for this opportunity, and just thank you for sharing with us. And I pray that this platform makes a difference for many people. With regard to my story, my relationship with multiple myeloma, I would say it was quick. I've been real busy most of my life. You'll see I've owned businesses, I'm pastoring, and I've got 4 children at the house at the time. They're all grown now, but I enjoy being busy. I was on my way to a doctor's physical because I run 15Ks, middle distances. When I went in, that's when I found out that I had multiple myeloma. I had no signs, no indications, nothing that I related to the normal pain that a runner deals with. And so once the doctor informed me, within 30 to 45 days, the process began. And that's one of the points that I try to make, that very often, we want to do our homework. We want to do background. But the way I saw it was this. I'm sitting in a cancer center. Where am I going for better information? I didn't trust just floating out there on the internet, having someone tell me about something this serious. So my background had to do with where I was, and I developed a trust with the doctors and the staff because this is what they had to lead in. My question was, what can I do? I did not spend a lot of time with where did it come from because they had already explained to me that was not something that we were able to say at the time, not for anyone. And so I didn't spend a lot of time with theories and background. Look, this is serious. Let's approach it. Let's move forward. I wasn't excited by the information that I read, particularly the morality stuff. I'm healthy, strong, running, doing stuff, and I didn't like the dates, so I didn't accept them. Uh, and and I went forward through the process. I did a stem cell transplant, and and I stayed on a healthy, do all that you can do, and do everything you're asked to do type process. I began to go to all the conferences, any type of training, information in the hospital. I went, and then I began to volunteer. I started teaching, not teaching, but I was volunteering with the orientation team at the cancer center. I've done that now for about three and a half years. Um, this pandemic hurt. It hurt because with this myeloma, we've been taught to be very cautious. We already know about masks and how important it is. And so when the pandemic came up, I didn't have a lot of outlets. You have to stop being around people for a while. But I thoroughly enjoyed being in the hospital with patients who were preparing because I could answer real questions. I could feel their hearts. I knew what they were asking that wasn't coming out of their mouth. And so when the pandemic came and we no longer had those classes, it took an emotional toll, and it still has, because you're isolated. You're just isolated from everything. And I'm sorry, I'm going off of my story, but my story has been that of accepting what it is, trusting the doctors, the process, learn of what they're doing, how your body is responding. That was my approach. And then get involved with some new things. I had to come up with new normal, as they call it, but it wasn't just a new normal, it was new everything, because I still haven't moved back into any level of social interactions. It's just, it wasn't that important. I've spent 40 or 50 years in front of people, all the time. And so I wave at them and I'll see you again. But right now it's telephone, it's this, and it's waiting for the opportunity to be involved again in helping and communicating with our community. It's just so much that needs to be said, as you've mentioned. So much information. Okay. How's
I
that
have
for
a
a
few
story?
more. No, that's a serious story, and there's more to your story, and I want to
Yes, it
get
is.
into it even more. But as we look at all of the stories, because what you said was so real, because you didn't even know that you had it, and speaking on that same subject, Miss Alexander, can you tell us your story on how cancer affected your life?
Well, the way I learned about myeloma is through my husband. My husband was Elijah Alexander. He played in the NFL for 9 years. And a couple of years after he retired from the NFL, he started complaining about pain in his feet, just weird little things, nothing really frightening, nothing alarming. And he kept going to doctors, and doctors were dismissing it, saying, hey, you played football. You've been playing it since you were 5 years old. Of course, you're going to have pain in your feet. At the time, he was about 35 years old, and it just so happens he went on a golf trip with his friends. And during that trip, he became ill on the flight, and a doctor came into his hotel in Costa Rica. That doctor in Costa Rica was the one that did blood work on him and said there's really something terribly wrong here. You need to get back to the States and have a full workup done. And so he did that. And within days, he was diagnosed with multiple myeloma. We were absolutely stunned. We had never heard of it. I think for myself, in my head, you think really fast when you hear shocking news. And when I heard cancer, I immediately thought, oh, they'll cut it out. He'll receive chemo, radiation, it'll go away. But then when I realized it was a blood cancer, I knew we were in for a different type of battle. And so I ended up needing to learn all that I could to be a good caregiver for him. And that started our journey with myeloma. He lived with it for almost 5 years. He, had a stem cell transplant and did really well with it. But anybody who knows anything about myeloma knows it is truly a roller coaster. It's up and down. There's no cure for it, and it can come in and out of remission. And so our experience was just that. It would come in and out of remission, and we would have to try to figure out new ways to treat it. And ultimately, I lost him about 5 years later, back in 2010. And ever since then, I've just worked really hard as an advocate because it's really important to me to not only inform our own community and bring information to them in order to make better decisions if they need to learn about myeloma, but just to also teach people about clinical trials and the importance of staying connected and learning more and just being educated overall about multiple myeloma.
Wow. Wow. And every time, and I remember us talking a little bit about this before, and, every time you talk about it, it's so real because I know it was just a life-changing experience. It's, you go from one extreme to the next, and then the roller coaster ride, and hearing, the pastor talk about it, Robert, it's just unbelievable. So I want to bring a solution or some understanding to this problem in a major way. And I want to ask Dr. Michael, can you tell us about multiple myeloma and the early symptoms and how important it is for leaders like we have right here to be out here and speak and get the word out to our communities? And obviously, I hear it affects the African American community more than anybody else. So if you can you share some insight on what is it, how to find out what the early detections are to make sure that we can catch it in the beginning, and give me some information. That's what I'm asking for.
Well, it's a privilege to be with you today, and I'd listened to the inspirational stories of these two with us, and it touches my heart and reminds me why I do what I do, because I love my patients and I hate myeloma, and I'm doing my very best to try and come up with a solution. Well, you can just call me Dr. Joe. People call me Dr. Joe for short, and that makes it a bit smoother. So we've come to learn that this is a really challenging disease. So in real simple terms, our blood is made inside of our bones. We call that the bone marrow. It's kind of the factory of our blood. And there's a particularly important cell in there called the plasma cell. That's the cell that makes antibodies. We've been all talking about antibodies this last year to COVID or to measles, to mumps, rubella after a vaccination or after people have been exposed to things. Those important cells that make those antibodies are plasma cells, and they're really good cells to do that for us. Unfortunately, myeloma is a cancer of the plasma cell. So now instead of making good antibodies that fight off infections, they create bad antibodies that can damage our bones, damage the kidneys, and really make people very sick and at risk for other infections. And so we've learned a lot about myeloma over the years. As you mentioned, Dougie, the myeloma is twice as common in the African American population than it is in the Caucasian population. It's also diagnosed at a younger age on average. We heard about Elijah's diagnosis at the age of 35. I mean, the typical average age of diagnosis is around 70. It's about 65 or 64 in the African American population. And what has been exciting about myeloma is we've made all these great advances, and we've seen people living much longer with the disease now than they used to. But unfortunately, we have not seen that same improvement in the African American community. And a lot of that has to do with lack of access to the key kinds of drugs. I often call them the three T's, what we call triplets or the combination drugs, transplants. We've already heard about stem cell transplants, and indeed clinical trials. So our motivation and work in the foundation that I work with, the International Myeloma Foundation, is to raise awareness around myeloma. Although in Robert's case, he had no symptoms, and in Elijah's case, we saw that he had some pain in his feet. There really is no one perfect symptom or sign that points us to multiple myeloma. Often people do have extreme fatigue. They have pain, in particular bone pain. If they're seeing their doctor and their doctor sees that some of their blood counts are low or their kidneys aren't working well, those are things that could point us towards myeloma. So we want to raise awareness in the community so people can talk to their doctor and say, I'm at higher risk of myeloma. Could these signs and symptoms I'm having point towards myeloma? We try to raise it with the family doctors and teach them about myeloma so that they don't miss it. Even though it's a pretty rare cancer, less than 2% of cancers, it's, as we said, much more common in the African American community. So it really takes all of us working together to raise the awareness, to educate the primary care doctors, and to really advocate for access, because we do know that when African American patients can get the same access to the right treatments, their survival can be better, in fact, be even better than in Caucasian patients. So there's a hope here, but there's also a very awful situation here that we need to overcome.
And it's based on the lack of information I'm seeing now, right? I mean, it's based on people not having this information that that you're sharing right now. I mean, it seems like that's one of the major issues. I mean, to resolve this problem, there's no information, and even on me saying that, I want to add to that if a person has, this is another question, if a person has this particular disease, and are they more susceptible to COVID, or how does that fit into this situation?
Yeah, that's a great question. And you're absolutely right about the information. This has maybe been what the pandemic has really hurt us all in, is sometimes there's too many sources of information and we can't distinguish the right information from the bad information. So we want to provide a reliable source. At the IMF, at myeloma.org, we try to provide clear, basic information so people can understand this condition. But you're very right, my friend, that unfortunately, because myeloma is a cancer of the bone marrow, or of the factory of our blood, it impairs our immune system. So that's been part of the unfortunate double whammy of the pandemic. Not only, as Robert shared with us, has it isolated individuals, not only has it increased what we sometimes call the digital divide, where when we were seeing our patients mostly virtually, there are certain groups of people in the community that we know have less access to Wi-Fi and less ability to connect, and that was clearly more within the African American community. And then add to that the misinformation and the lack of trust. It really made the pandemic a scary time, because in addition, those myeloma patients were more susceptible to COVID because they don't have the same immune system to fight it off. Thankfully, the vaccine has helped dramatically and has really improved that situation. But even then, we know that all cancer patients, and in particular myeloma patients, don't have quite the same reaction to the vaccination. They don't develop quite the same immunity. And so that's why we've been advocating for people to get their booster shot and for people to take the kinds of precautions to protect them from this infection.
This is unbelievable. And I mean, I appreciate you sharing this information, Dr. Joe, because it's so important. I mean, a lot of people are in a state of fear because of lack of information. And one of the things that I wanted to address with you, Robert, as well as you, Miss Alexander, like, how does faith work in this particular situation? I mean, with the global pandemic, with everything going on, with you talking about you being isolated and all of that, how do you navigate through all of these trial and tribulations, the twists and turns? Life has been unpredictable for all of us. Nobody on this panel could sit back and say that life has been normal for these past 2 years. So how do you maintain faith through this journey?
If I can, how they used to say, Doug, that life, and this is it. This is life, and what faith does for me, and I try to help others, is to anchor you, because the winds are going to blow. And with regard to cancer, it has such a detrimental mental impact that when we hear the word cancer, we automatically go somewhere. It always means death. That way we don't have to skip around. And so now to get beyond and apply hope, that's where faith comes in. The hope. And for me, you need information, as you said, because faith comes by hearing. And you got to hear the information, the facts. As I mentioned when I first started, we were looking at 48 months lifespan. And then I was at a conference and I met a young man who had been living with myeloma for 15 years. I almost stood on the table and shouted because I just needed a target. I just needed someone who had gone beyond. I didn't know anything about myeloma. I never met anybody. And I just needed something to anchor my faith on. And when I saw that gentleman, and boy, he looked good. I just smiled. I said, yeah, that's good. And that's what I try to share with the patients and the people that I speak with. That level of hope that's based on facts is going to be different, and I bring those in, but you got to accept that there's a team that you must trust and you must communicate with. And then they're going to ask you to do things. Your faith was going to have to guide you and stop you from complaining and move fear off the front level so that you can confront whatever it is that you need to do. It could be that pain. I've talked to some patients and it just breaks my heart because they live with such discomfort. And I'm so grateful that there's some things that I haven't experienced. I'm 7 years now. This is my 7th year, and I'm extremely grateful. And my ears stay open to learn more and to be available to do and to help make a difference where I can. Faith lets you endure the humility. It's a real humbling event, because you don't do. Whoever that guy was a few years ago, I'm not him anymore. And, learning who you are, how you navigate, what your new strengths are, where your confidence is, and believing that you ought to be planning for tomorrow. That's where my faith is. Yeah.
Beautiful,
Yeah.
brother. That's beautiful. And how is it for you, Miss Alexander? I mean, because you're still out here fighting a good fight, and you went through it. You've seen it close up and personal. So what what's motivating you? Where is your energy at?
Well, that's a really easy question for me. What motivates me is the fact that there's no cure. What motivates me is the fact that I still see myeloma impacting our community in ways that it shouldn't, and knowing that a lot of it comes down to lack of information and lack of access. And those are the things that need to change. And I feel like COVID really exposed everything because we started to realize people just didn't have access. They didn't have the correct information. There's so many misconceptions about what actually happens when somebody, goes through a clinical trial. There's so many misconceptions about who to trust within the medical community. And so knowing all of the things that we know now, I want to say thanks to COVID. There were some things that happened due to COVID that I wish we didn't have to endure. But one of the things that it has made a lot of us realize is how much work there is that still needs to be done. And I feel like a lot of ways that we could make some real headway is through technology. Because of COVID, a lot of myeloma patients, cancer patients in general, were isolated, because of the comorbidities, because of the underlying health conditions. People couldn't be around each other. And to me, it seemed like it was a good opportunity for people to connect online. Everybody has a phone, everyone has the ability to connect with other people that have information that can help them and build online communities and just figure out ways to really move past where we have been over the past few years in order to help find a cure for myeloma, because that's one of our biggest issues, with African Americans not being involved in clinical trials, without being parts of the conversations where these hospitals and physicians and pharmaceutical companies are having conversations trying to come up with a cure. If we're not involved, we can't be a part of the solution. And so we really do have to start learning how to be more proactive, be more open to learning more, be more open to sharing. I think we were all aware of, one of our favorites, Chadwick Boseman, having his own cancer experience and choosing to stay quiet about it. Like, I think that's one of the things we really need to make sure that we change. We start to share more, connect more, communicate more in order to help make some real progress when it comes to cancer treatment and better outcomes.
That's so real, man, because I agree. There's a rapper right now named Kango from a group called UTFO, and he's sharing his experience. I mean, and he's online showing. I get calls from different artists that's there supporting him. So I agree with everything that you're saying. And I want to thank all of you together, just for being, just strong advocates to get the word out and just help us, really change these conditions and give people solid information that they can use, and I definitely want to thank Bristol Myers Squibb, for this discussion, this tremendous conference that's unbelievable. I know it's going to change a lot of lives. And also, I'm gonna say it in a short way, but BMS, which is Bristol Myers Squibb, is committed to advancing healthcare support and solutions without it being therapies and all of this stuff, and just it's beyond the pill. And I want to thank them just for putting this together and educating and being here for us to help get this out and change the conditions. I want to thank all of y'all for being here with us, and I look forward to doing more work with you. And obviously, we're going to continue to do work with Bristol Myers and Squibb because they're on the front line and they are definitely doing what got to be done to get the word out. So thank you for your time.